Hey guys, today I'm just going to explain what pancreatitis is and what can cause it and how to detect it, etc. A lot of patients ask me questions about, oh, I have pain and is it pancreatitis? And it's pretty simple. Let me show you a picture here. This is the pancreas. You can see the pancreas lying behind the stomach, and there's a duct that comes from the pancreas and joins the bile duct and opens into the small bowel. You see here? So that is a pancreatic duct, and the pancreas extends all the way behind the stomach. And whenever this gets inflamed, you can see it. It looks like a little reddish here in the picture, so that's how it should look on the inside when you have acute pancreatitis. So pancreatitis, most common causes of the pancreatitis are alcohol use. Like if people drink a lot of alcohol, it irritates the pancreas. Second thing is if there's more common in females, if you have gallstones, or like you can see here, these are gallstones in the gallbladder. Sometimes they can get blocked in the bile duct and obstruct this passage and cause the pancreas to get irritated. That's called gallstone pancreatitis. And sometimes there could be sludge, which is like powdered stones in here, which can also block the pancreas and cause irritation. So that's one reason, and it's generally more common in females. And then there are other things like medications that can cause pancreatitis. And there is other times you get your lipid profile done every year with your primary care doctor. So there's something called triglycerides in it. If the triglyceride levels are too high, usually several hundreds to thousands, then you can develop pancreatitis. And other times, high calcium levels can cause it. And there are also some medications that can cause pancreatitis, and the list is extensive, but when you come to a gastroenterologist, they usually are able to figure out in a decent manner as to what caused the pancreatitis. But even with all that, there's almost like 30 to 40% of the cases where there is no cause of pancreatitis. So that is called idiopathic pancreatitis. So what happens when you get pancreatitis? You have severe pain in the upper belly that goes straight through to the back, and then we do a CAT scan to diagnose it. You can also get a blood test called lipase to diagnose it. So what does the doctor do after he diagnoses it? So he doesn't let you eat, which is important for pancreas, because whenever you eat, pancreas produces all the enzymes necessary for digestion. So it would get stimulated when you eat. So first thing is don't eat. Liquids like water is okay, but nothing more. Some people have even pain with drinking water. But first thing is, if you have severe pain like that that I described, then you need to go to the emergency room right away and get it diagnosed first. Don't stay home. So next, after, if it's mild case of pancreatitis, you get home. Okay, then you're not going to eat anything for a few days except water. Then once your hunger returns and your pain levels subside, then we slowly start patients, whether as an inpatient or even as an outpatient if it's a mild case, on like a soup kind of stuff. Then we slowly progress to mashed potatoes and like low-fat food. And then for whenever you have an episode of pancreatitis for 4 weeks, it's best not to eat like fatty food. You should always eat like low-fat food because fat stimulates your pancreas. So these are basic management tips, but also avoiding alcohol is a big deal, because alcohol is a major cause. And then we look if the gallstones are causing it, then we remove the gallbladder if that's the case. And then we also look for incriminating medications. But once this pancreatitis happens repeatedly, then it can go on to cause something called chronic pancreatitis. And the chronic pancreatitis can cause severe pain that remains here and goes to straight through to the back. And that is a whole different animal and it needs to be managed. So, but otherwise, if you have any issues, you could approach your gastroenterologist or your primary care doctor to get more details.